confirmed cases right here. Let's see. Okay. Oh, we are going. Okay. So yes, we're at 195,000 cases here in New York State. We have right here in Rockland County, we have approximately 8,000 confirmed cases, and in Westchester County, another 20,000 confirmed cases. And unfortunately, we've seen so many people pass away from this horrible, horrible disease. And it's been people we know, and so it's been touching each of us personally, and my condolences and my prayers go to the families of those who have been lost. We now have 10,056 deaths in New York State, and it's just extremely concerning. So my office remains open to everyone to use as a resource. If you have questions, a problem, you don't know who to call, please call me 845-623-3627. And even though our office is physically closed, it remains open to you to use as a resource. So please call me, email me. We're here to answer your problems, your questions, and try to get you on track in the right direction. There's been so many problems and so many unforeseen consequences because of the coronavirus. And we're dealing with that every day. And as a state senator, the way that I can help the best is when I know that the problem is occurring for you. And there's been so many things every day. We're learning new situations and scenarios that have unfolded. So please call me anytime. Again, it's 845-623-3627. And my email is carlucci@nysenate.gov. And please don't hesitate to call or email me, or if you're talking to a friend that's having a problem, please have them contact us. One of the things that's keeping my office busy is the unemployment claims, and we've seen a record number, unfortunately, of people being laid off over the past couple of weeks, record numbers, and people are trying to file their unemployment insurance claims, and the Department of Labor has been very backed up. And so we've been trying to help people with those claims, but there's so many issues that are going along with that. The Help America or the CARES Act that was passed adds so many different pieces to help get the economy, really preserve it and make sure that we don't fall further behind. So there's a lot of details in there, but please do contact me if you have any specific questions. I wanted to get to, we have a special guest tonight, someone who's back again, who has really been at the front lines in helping so many people in our community, and that's Dr. William Greenhut, who is the Associate Director and a physician at the emergency room at Nyack Hospital. So the Associate Director at the emergency room at Nyack Hospital, he's been extremely busy. We've had some time to talk and to catch up, and he's shared with me some of the things that he's been seeing on the front lines. And we had a great conversation last week, and so he's been able to find some time to join us again. So Dr. Greenhut, thank you for joining us. Thanks for being here.
Thank you. I'm grateful for the opportunity to speak with you and to the audience.
Yeah, thank you so much. And I know a lot has changed over the past week when we spoke, and it's changing every day. We saw the governor announce today that he believes that we've hit an apex, that this is where we might be plateauing with the amount of hospitalizations. What are you seeing, since you're right there at Nyack Hospital? And just so listeners know and understand, in Rockland County particularly, it's been seen as one of the highest per capita infection rates in the nation. And so Dr. Greenhut is right at Nyack Hospital in the emergency room. So it's really great to hear your perspective of what's happening. What do you make of that you believe that we might be at an apex?
So what we're seeing is a lot of fear and sadness. As you mentioned, and I echo, our hearts and thoughts and prayers are with families and their loved ones who have been affected by this illness. Most people in this region have a family member or know somebody that's been ill from COVID-19. Some of us have lost family members We lost a family member. I have a dear friend who's fighting for his life right now. I have a dear friend who lost her father. We think about everybody, and of course, our patients and their family members as well. Because what we have are people that come in distress. They're scared. We're scared with them. We show them confidence, but we have our own anxieties as well. And we do everything we can for them. And unfortunately, we are their substitute family when they come into the hospital because we have visitor restriction policies. So, what I'm, and, of course, trying very hard to do is communicate with the patient and also to their family, give them some comfort as we're helping them navigate through this crisis. In terms of volume of patients, we're seeing, it's true, a plateau. The number of cases is leveling out, but still remaining quite high. And patients that are admitted to the hospital today may wind up staying in the hospital anywhere between 3 to 5 days or up to 2 weeks. So many of our population in the hospital were admitted from 2 weeks ago. So even though we may have a leveling off in the number of daily admissions, we're still at maximum capacity in the hospital and bursting at the seams, as I mentioned last week. This is a time to reflect on the interventions that we've all been doing as best as we can, best as we've been doing, which is social distancing, wearing a mask, washing your hands, and self-quarantining if you're feeling ill. We had a dramatic spike. Looking at the data in the middle of March, we increased our admissions for patients suspected to have had COVID, went from maybe 6 patients to 130 patients. And that required heavy resources in the hospital. The social distancing has helped to limit and truly flatten the curve. We are seeing that. But also, I remind everybody that we're not done. What we have been doing has been working. We need to stay this course and keep doing what we're doing because it is working. We haven't seen a dramatic decline in cases yet, but I believe we will get there. And we will also be a model for not only our neighborhood, but the entire country and the rest of the world, because we can show that this will be done and we can make a difference.
Well, Dr. Greenhut, that's something I wanted to ask you, that you are on the front lines, you've been seeing what's happening firsthand. What is some advice that you have to physicians around the country that might not have seen these type of cases yet and the surge that you've seen?
I encourage them to use social media, get involved in whatever your social media avenue of choice would be, because my colleagues and I are publishing and writing information from the front lines. We're doing things like this. You need to hear us and be an advocate for your community. I'm sure that the message is getting across to the medical community. Unfortunately, we do see a lag. We saw a lag in New York itself. It's human nature to not necessarily buy the hype or want to get upset about something that seems so far away. But it may hit home in your community. We are seeing states with heavy populations, such as California, that practice social distancing early on, reap the fruits of their labor. They did not have dramatic spikes like in New York and New Jersey. We'd hate to see communities throughout the country not put in the measures to protect their communities. So physicians, local leadership, community, even everybody in the population that has some sort of influence on your family and friends, you need to trust and see the example that we've set in New York State and in New Jersey. New York and New Jersey have more cases per million than any other country in the world. We are basically the model for the entire world, and people should look to us as an example, especially physicians.
We've heard about the surge and flex policy that the governor's put in place, where the resources are supposed to be coming to the places that need them most. In New York State, we're a pretty big state, a diverse state, so the idea is you can move those resources where they're needed and have really a national response to that as well, that as the apex is hitting different areas of the state and the country, that resources can be deployed there. Have you seen that in the works on the front lines?
Well, fortunately at Montefiore Nyack Hospital, the administration did the legwork and helped secure adequate PPE space and ventilators and staff ahead of time. We saw this crisis coming. We're not the same as New York City, where it was, there's just millions of more people, so their systems were overwhelmed. We have benefited from the state in that we've received additional ventilators. We have not run out of ventilators because of the assistance from the state, so we all thank you. I watched an interesting video. It's from the New York Times. I forget which hospital they visited in New York City. I believe it was in the Bronx, probably Montefiore, but I can't say for sure. And in that video, you could see, if you could search for it on the internet, you can see how there is, and I believe it's state mobilization, perhaps even federal, of moving patients out of that hospital and to other locations. Perhaps you can speak more about that, because offloading patients to hospitals that are not overwhelmed would certainly, spread the adequate care throughout the state.
Yeah, that's something that's so important, and that's why we've been looking at that idea. And we talked about this a little bit last time about the field hospital, and the idea is that you have it ready to go, but the big concern has been the access to ventilators and what would really be needed as an ICU facility. What do you think about the need for a field hospital? Do we see the need right now in Rockland?
As I mentioned, we're bursting at the seams, and we'll take all the help we can get. What I would hope is that along with the space would come additional trained staff and, of course, the resources, including ventilators. We have not run out of space and ventilators and staff because we've been innovative and fortunate. The community has supported us not only with donations, PPE, but they have come and volunteered. We have EMTs that are employed in the hospital now, making a huge difference in terms of helping us manage patients. We have people that have reconsidered their emergencies and thought, maybe I should stay at home and let the hospital work on the most sick patients. So that reduction in volume has helped us focus our attention and resources on the sickest patients. And as I mentioned last week, we have a brand new emergency department that was scheduled to open up, and it expanded our space by 50%. And what that allowed the hospital to do was build 2 brand new ICUs in that space. We currently have about 2 official ICUs and 3 or 4 additional makeshift ICUs to manage the large number of patients, unfortunately, on ventilators. But there is good news. We have had several, or many, I should say, successful extubations. That's somebody coming off of the ventilator and being discharged home. We look to those examples as a beacon of hope, and we try to remain optimistic. We give everybody exactly the best care that we can provide with the knowledge that we have today. Unfortunately, many people are succumbing to this illness, but there is a beacon of hope, and we should focus on the success stories.
Yeah, that's what we hear. I mean, one of the success stories that we see, we take it with silver linings where we can, but the idea of in New York State, there's about 2,000 people being admitted to hospitals every day. And when we take the people that have been discharged, like we just talked about, either they've been removed from the ventilator, but then ultimately discharged from the hospital altogether, we're at just about 118 people each day, which is, a step in the right direction, hopefully. So when we take the 2,000 that are admitted and then the people that are discharged, we're at about 118 every day. Another thing I wanted to ask you about is we keep hearing about the personal protective equipment, about how essential it is for our people that are our healthcare workers, but anybody that's in the front lines there. And the governor insists that the personal protective equipment is adequate at the hospitals. When I talk to others, I hear different stories. What do you see, and what do you think is happening in terms of the different opinions that we're getting from different parties when it comes to the personal protective equipment?
So my perspective is from my workplace, and we've always had adequate PPE, even before the storm hit. In the beginning, it took some creative processes, but we've always been safe. We've also had some staff members purchase things on their own, often being reimbursed. My practice is Envision Physician Services, and they actually offer every clinician a stipend to purchase our own PPE, which may be above and beyond basically the bare minimum. And by doing so, what we're able to do is, shift resources back to the other hospital staff members who aren't as fortunate to ensure that they have everything every day. PPE is not just N95s, it's goggles, it's surgical caps, disposable gowns, gloves. We know that the community does have a need for those in their own private life, but really the N95s, the PPE that helps protect us from patients who are sick, thank you so much for directing those to for our use. We really appreciate that.
Yeah, no, it's been such an issue, and we're hearing every day from different groups and different people about the different issues that are hitting people in those unique ways. The other day, I was with an organization that is using 3D printers to print face shields, and the Northeast Project, and we're trying to help promote them any way that we can. But they've been coordinating with different people that have these 3D printers in their homes. They're using a new design that is less equipment or less product to use, so it makes it more efficient. And we were able to deliver 500 of these face shields over to Good Samaritan Hospital, and it was really yes. And I was with them at Good Sam. But yes, they've been distributing them. That was the first large-scale drop-off that they did over at Good Sam, and they've been making a priority to focus on Rockland County, knowing how we've been hit so hard. So that's been good to see. And I mentioned them, and there's so many others that have been trying to do what they can, using materials that they have available to them to make whatever type of PPE they could. Do you have any recommendations to people that are?
Yeah, there's this one non-for-profit. I'm trying to find the picture because I want to get it right. They are local construction personnel from the region who have constructed plexiglass boxes that essentially envelop the patient's head so that when they need to be intubated, the anesthesiologist or emergency physician, all they need to do is place their hands through the holes in the plexiglass box to do the intubation. It's a very dangerous procedure because not necessarily for the patient, but it aerosolizes their respiratory droplets and can spread the virus throughout the entire unit. And this box helps to contain the aerosolization. It can be draped as well. And as long as things are done in a controlled environment, ideally in a negative pressure environment, it theoretically will reduce the spread of the illness. I really want to give a shout out to this group. I'm going to find it during our conversation. I'm looking frantically on my phone because they delivered 9 of these to the hospital this week. Here it is. It's called maybewecanhelp.org.
What is it? I'm sorry.
Yes, maybewecanhelp, all one word, .org. I encourage you, everybody, to check out that website. They may be asking for donations. It's going to a great cause.
Oh, that's great. And so they're making a plexiglass type box that goes around the patient. So this is actually around the patient to protect the healthcare workers, particularly during specific procedures.
Correct. Yes. And
wow.
We're great.
And you've seen this, and you've seen it in practice.
Yes, we received the shipment over the weekend, and the feedback has been we've been extremely grateful, particularly the anesthesiologists, and we are grateful to our anesthesia crew because what they have done is designed a team where they wear a special mask and helmet with what we call positive pressure, so it helps to protect them from droplets, and they have been critical in placing patients on ventilators because we don't want to have to ever put somebody on. It's an emergency, and they're there whenever we need them throughout the entire hospital. They've been busy, and they've been saving lives as well.
Another question I wanted to ask you, I've been getting some concerns about, everything is just exposing itself because everything has been kicked into high gear. So the issue of patient advocacy and how what we found is there's some guidelines, but every hospital is a little bit different in terms of how they're communicating with families and how they're advocating for patients. And we know and understand that since there's been this surge in terms of the hospitals being at absolute capacity, the fact that patients are not allowed to have visitors, and because of the contagiousness of this disease and the crowding at the hospital, I've gotten great feedback from Nyack Hospital and Good Samaritan Hospital right here in Rockland. But however, in other hospitals around the region, there's been a lot of concern about a few things. And really, the big thing is about how to communicate with patients' loved ones, their family members. And I understand because I can see how, as a hospital, the number one issue, and particularly in the emergency room, is it's triage. It's doing everything you can to provide care to that person who's just come in, because in many times, and particularly now, it's the difference between life and death. And how a second thought definitely would be, okay, communicating what's going on to a family member. So I've heard good things about Nyack Hospital. What do you think to tell us, the layman that like myself and that's watching, what that is like and what we should be thinking about as, let's say, a loved one goes into the hospital? What should we expect as far as communication, and what do you think the hospital should be doing on that end?
Okay. So because of our restricted visitor policy, patients are often coming in alone and scared. I want to be able to reach a family member or a loved one or a guardian. I need to.
Right.
Occasionally, patients come in and their family member has, intentionally held their cell phone because they don't want it to get lost. That cell phone is so essential to them to be able to reach you. Plus, it has your phone number in it in case it's not updated in the computer. I want to get in touch with you. Speaking personally, in the emergency department, if you call and you want to talk to a doctor, I will pick up. I need to talk to you. We need to review your loved one's situation and their wishes should they not be able to speak for themselves. We have a fundraiser going on in the hospital. I don't have the link up right now, but a couple of physicians are organizing purchasing video iPads or video handheld devices so that we can get people in touch and be able to see their loved one on a more frequent basis. I can't tell you the schedule, but I do know that the ICUs have been developing a schedule so that family members can get a reasonable update, ideally twice per day. This is within the works. Not sure if it's official yet because I don't work in the ICU, but the hospital is taking steps to improve communication. There are some hospitals in the region that you can see videos online. They're just completely overwhelmed, and every staff member seems to have zero opportunity to speak with family. We do need to speak with you, and if you call and I'm working, I will pick up.
That's great. That's great. And that's it. I mean, we have to appreciate and understand that balance between our healthcare workers, our doctors, our nurses are just being worked to the bone, and every free moment is dedicated towards this crisis. So it's something that has come to my attention. I appreciate that feedback, and that makes a lot of sense. And if you can share with us that information about the fundraiser that is going on, that we can help promote that, and looking to best practices to share with around the state and around the country as well. So I really appreciate that.
If you send a loved one in with a cell phone, send a charger with them as well, and put a piece of tape on it and write their name on it so it stays with them, just in case it gets stuck in an outlet somewhere in the hospital.
That's great. Great piece of advice. That's a great piece of advice. Makes a lot of sense. We've been hearing a lot about hydrochloroquine and Zithromax, and I figured it'd be great if you could talk to us a little bit about that. You read one article, you hear one thing, you watch a news clip, you hear something about it that it'll solve all of our problems. Then you hear others say, well, it hasn't been studied enough, that it's not for this. So we're hearing all types of things. Would you be able to comment on that? Some of these drugs that we hear about that might be able to help or might not?
Okay. So as of today, I lost your video. Hello?
There we go. Shoot, come back.
Okay. So as of today, there is no standard recommended medication for the treatment of coronavirus, COVID-19. As a physician and basically scientist, we have to follow the data where it leads us. Cannot take a medication and force it to work. We have to do controlled studies and use statistical information, peer-reviewed information to help make decisions. Now, that's not to say that we are not willing to try new medications, especially on a compassionate or emergency basis. If a patient is in a dire situation, they may qualify for use of hydroxychloroquine in the hospital. Our inpatient physicians, particularly infectious disease and intensive care unit doctors, are providing this medication to a select group of patients. I cannot disclose because I honestly don't know if it's working. My hunch is that it is not an effective medication. However, like I said, I'm a man of science. If there is data that shows that it's effective, I would certainly endorse its use and perhaps even prescribe it. But as of right now, the clinical practice in our emergency department and throughout the country is if you're in the emergency department and discharged, a prescription for hydroxychloroquine is not usually going to be provided. It is with some risk. It's an intermediate risk medication. It can affect electrical conductivity through the heart and can cause the heart to have potentially life-threatening abnormal rhythm. It's rare. However, that medication could potentially harm a person that would otherwise recover without significant incident. So giving that to a patient without rigorous evidence could potentially hurt you more than help you. That's why we don't just give it. Does it work? We don't actually know yet. We don't have enough science or data to support its use.
And why is this drug being talked about so much, and what would be the purpose? What is it doing? What's the goal for the hydrochloroquine?
So there's very limited information, mainly published in other countries that we're following their lead, that this particular virus attacks a molecule that contributes to the hemoglobin on the red blood cell. Now, hydroxychloroquine is not an antibiotic, and coronavirus is not a bacteria, it's a virus. There's no medication that kills the virus. Now, there are numerous clinical trials on antiviral medications that are being produced, including here at Montefiore Nyack. We are undergoing a clinical trial for an antiviral medication. And we are trialing, I don't know if it's being studied as rigorously, but we are trialing hydroxychloroquine. Now, hydroxychloroquine is thought to manipulate the surface of hemoglobin and interact with the virus's ability to affect the red blood cell. That's my limited understanding. As far as azithromycin goes, that is also not necessarily directed towards the virus either. It is an antibiotic. It treats a large number of respiratory bacteria in the lungs. And I may prescribe that in addition to possibly a secondary antibiotic if I think there's a chance you have bacteria contributing to a pneumonia. Coronavirus is a mimicker. It creates a pneumonia pattern on chest x-ray, often severe, or I should say sometimes severe. If I'm sending you home and I choose an antibiotic, azithromycin may be one of them. Now, azithromycin also has an unknown risk in terms of cardiac arrhythmia. It's suspected, and we really should be using decisions to determine if it's safe to give hydroxychloroquine and azithromycin. If it's a matter of mercy or compassion, then the potential benefits exceed the risk. But if you're going to go home and recover otherwise, whether I give you the medicine or not, it's not worth the risk as far as what we know today.
Well, thank you. That gives me a lot of information, and I'm sure a lot of people watching, because it has been somewhat confusing to hear this. And it's like sometimes what drives me crazy is in the United States where we have a system where you can actually advertise pharmaceutical drugs on TV. We're one of the few countries in the world that can do that. And even though this drug isn't being advertised, it's kind of being talked about in that way. And it gets to the point where you have people demanding, oh, I need this drug or that drug, and not having any type of medical experience or whatnot. So thank you for providing that information.
And you may go online and find polls with physicians that endorse its use, and that's their opinion. And You just like anything in medicine, you may get various opinions. That's why you may want to occasionally get a second opinion about things. But
Yeah.
if you're coming to see me and you're asking for my opinion, I don't know if that there's enough evidence to show that in a generally healthy individual, hydroxychloroquine will cure your illness.
Yeah, no, that's it's really interesting, and we're going to have to follow that closely. I mean, one of the things that the New York State Department of Health has been working very hard on is the issue of rapid testing. That's something that we have to innovate and make sure is available to the public. From your point of view, what do you think the future of rapid testing means, and how imperative is that?
Rapid testing exists. We are implementing it throughout the system for inpatients because it does help streamline where we move them throughout the hospital. And because, for instance, patients who are positive may not be able to enter certain areas of the hospital that they otherwise would. And we want to get them the maximum amount of care that they require safely. So the faster we get a result in the hospital, the faster we can do what we need to do for them. In terms of providing rapid test results for the public, I've said this before, I'll say it again. If you're feeling ill, there's a chance you have this disease. You need to self-quarantine. Finding out a result, although may make you feel better, it also might make you feel worse. I know people are looking for confirmation, but if you feel well, assume you have it. And if you feel very sick, such as short of breath, or very high fevers that you can't control, or pain, then you're welcome to come to the emergency department. We should take a look at you and make sure that you're safe. I think that the most impact on society will come when we are able to detect antibodies from blood testing, because that will truly tell us who's been exposed, who's been potentially immune, and who can, return to work and back to the community. We want to get people out, back to work, back to enjoying life again. But it has to be done on a controlled basis so that we don't suffer, a relapse, essentially, a second spike, so to speak, in terms of cases. Because if we leave, if we get too close to one another once again, there will be a resurgence in these cases. It's too soon. And about 7 to 14 days later, our hospitals will be full once again.
Yeah, there's a question that's come in and it says, how soon will low priority younger people be able to get tested so they aren't concerned about going back to work? And I think we kind of talked about that, and but that's really the big issue in terms of people want to get tested so that they know, hey, did I have this? Do I build up the antibodies? What do you have to say about that? What do you think about in terms of if you have got it, if you've recovered? Do we believe that there's an immunity to it? Where are we with that?
So, in terms of people who have been ill, we've been home for 4 or 5 weeks now, something like that. It feels like I don't even know what day today is. But you might go and get a test today, and you will be negative because you've cleared the virus potentially. Hopefully, you've had a relatively easy course there. Antibodies are detected several weeks to months later. There are some antibodies we carry around since childhood from our childhood vaccines. Those are for illnesses that we know a lot about because they've been around for hundreds of years. We've been doing antibody testing for as long as I'm aware. So we can confirm through science that you have immunity based on vaccines, certain vaccines. Some are not as great as others. We know that, especially with some of the recent influenza vaccines. Not perfect. No vaccine is perfect. We cannot assume that you will be immune from this disease yet. We don't have enough scientific information to support that. People who work in the hospital who have tested positive and have recovered, fortunately, we're gracious for that, that return are still required to wear full PPE, for the chance that they could get reinfected, God forbid. I can't answer the question how long immunity will last. You'll hear in the newspapers or read in the newspapers or online that there are cases of people getting reinfected. Is that truly the case? I don't know. Maybe they never cleared the virus to begin with, or they thought they were sick with something else. I just don't think that the evidence is there to give people certainty that they're immune. I hope that they are. And I also hope that they will donate their antibodies through convalescent plasma donation, which I'm happy to talk about, because their antibodies that they're producing today may save somebody's life. That's being actively studied and that's been implemented as well. I
Yeah,
think
can
it's,
you talk to us
yeah.
about the donating the blood and donating plasma? I've been talking to the blood center, and we know that they have been at a critical shortage, unfortunately, and trying to build that back up. And we talked to the governor's office about making it clear that donating blood was seen as an essential activity and a safe activity. And so we're trying to promote that as much as possible. But maybe you could tell us a little bit about why that's so important and who in particular should be donating at this time.
So blood in general is at a high need. Uh, I think the reason we're seeing less of it donated is because of the typical organizations that run these blood drives are
Yep.
focusing their attention on other things, where
Right,
people are
right.
reticent or reluctant to go out and expose themselves. Uh, I don't know how to fix that, but if I
Yeah.
do know that if you've been sick with COVID-19 and tested positive, 14 days later you can donate your blood to provide your antibodies. nybc.org, New York Blood Center.
Hmm.
They have a link right on their page. I believe Columbia University is also requesting a blood donation for their, testing and research. Montefiore in the Bronx is also doing research with convalescent plasma. This is going to become, everybody needs to know about this because we all know somebody who may have been infected and hopefully recovered.
Hmm.
Everybody that I know that has recovered is, in my opinion, a superhuman. They have superhuman strength and abilities right now. Uh, we're grateful for their recovery, and they're all very happy to still be with us, and they want to do whatever they can to support our country and our neighbors. So check out all of those resources.
So with that, when we're talking, I've talked to some people. They've been asking me questions. They say, "Hey, I'm recovering. I want to donate blood. I want to donate plasma." The big question there is recovering, and we have that 14 days since you've recovered. What is a good How do we know when do we start that clock? That 14 days.
My understanding is it starts 14 days after you tested negative for
Okay.
blood donation. That's my understanding. I could be wrong. I don't work with those centers.
Okay. But
However,
you're
the
actually,
course of
yeah.
illness can vary between 2 to 4 weeks, but you are producing antibodies all along. We would not want you to go out and risk exposing other people to illness if you tested positive. You want to give your body a chance to recover, not shed any viruses into the environment, and also make sure that your body is healthy to provide blood, that you're no longer dehydrated or malnourished from going through a rough illness.
Yeah. Well, Dr. Greenhut, thank you so much for joining us tonight. And I did have one other point. Oh, yeah. So with the iPads, we found that what people should do if they're interested in helping out with the patient experience, particularly at Nyack Hospital, that to contact the patient experience department, and their phone number is 845-348-6778. And they can also email patientrelations@montefiorenyack.org, and that's to help with what Dr. Green talked about in terms of having that patient experience where people can communicate with their loved ones when they are in the hospital, trying to bring that technology to the patients and their families because it's an issue that we've heard so much about, and trying to reach that happy medium where we're providing the best level of care, but we're also communicating with the families. I know there's thousands of people in Rockland and Westchester who lost their power today. Myself and Dr. Greenhut is one of them. I had to run over to my office, which no one has been in a while, so able to use that and get on here. And I know Dr. Greenhut also lost power. Hopefully, we'll get that power back on. I saw some photos of some real serious damage that this storm has done. So we're gonna have to sit tight and hope that we can get that power back on as soon as possible. But even with that, the power's down, but I still encourage everyone to contact me, call me, email me if you have questions, problems. We're all in this together, so we're going to get through it together. and we keep learning every day. I mean, there's so many different consequences and ramifications of all the policies that have been put in place. So I just want to thank everyone that's been watching. I want to sincerely thank Dr. Greenhut and your entire team at Nyack Hospital and all the healthcare workers and all the workers that are on the front lines. Thank you so much for the work that you're doing. I also want to encourage everyone to sign up for my email newsletter that we're sending out on a regular basis to keep you as up to date with what's happening. There's just so much going on, whether it's breaking down the CARES Act, that's the federal stimulus legislation that was passed. There's a lot in there. There's a lot of good information for us. We're trying to get that information out. I also want to ask everyone that if you would like to receive a text update, just text the word Carlucci to the number 797979. Again, that's Carlucci to 797979, and we'll keep you up to date. One of the things that we have to look out for is this stimulus check that Congress has passed and will be coming into our bank accounts. That should be very soon. Unfortunately, there are some people that might be left behind because of the process that the Treasury has put in place, that if you had not filed income taxes recently, that you would not be on the list. There is a website that's dedicated, and you got to be careful and use the right website, but the IRS has that website. We're putting links from my website, but this is other information that we're getting out there through our email blast, and that you would go to sign in to make sure that you get that stimulus check. So there's so many different programs that are going on, and we want to make sure that we keep you as up to date as possible. I'm going to be back here at 4 o'clock on Wednesday, giving another update on Facebook Live. But there's many other venues that you can catch us, but we find this is one that we can get great guests like Dr. Greenhut, answer some questions, and make sure that we're staying as up to date as possible. So with that, Dr. Greenhut, do you have any closing remarks or words of wisdom for us to follow?
I would just like to use this opportunity to especially thank our first responders, EMTs, paramedics, police, fire, everybody else, crossing guards, no, everybody. Construction, especially during the trees going down, they're exhausted. They're working super hard. Some of them are getting sick or worse. And we think about them, and we're just absolutely grateful for them helping in this battle right now and doing their part.
Well, Dr. William Greenhut, thank you again. Thank you for just spending the time with us and really communicating with us what's going on. I think your words are very reassuring to me and to many people out there that can watch this, and please share this with friends as well. We have our Associate Director of Nyack Hospital Emergency Room Department, Dr. William Greenhut, who is with us again today. Thank you so much for being here. And again, thank you to all our healthcare workers, all our first responders, and everyone on the first line of defense. Thank you for the work that you're doing. Your work is essential. And please, if there's any way that I can help and assist you, I'm here for you. And don't hesitate to call, to ask. Let me know the problems that you might be having, and we can get through this together. So thank you so much for joining us, and look forward to seeing everybody soon.
Bye-bye. Thank you.
Thanks.